Beep, 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 beep. Welcome to the Court of the ED Digester. Good morning, good afternoon, good evening, good night, wherever the hell you may be. How the devil are you, good people? Just had a fantastic teaching week with my folks. They were wonderful. New starters, January. We're all done now. It's done. We're into the February enrolment. So, not February, twat. March enrolment. So if you want to come and join us, it'll be March. More advertising going up in the next few days. Can't wait to see who comes on board and gets involved. Fantastic. Anyway, sometimes you get up in the morning, you see stuff, and you think, what? Like, really? Is this where the world's at right now? Starmer rattling on about teeth. What is Labour Party headquarters like right now? Right, what do we stand for? Teeth. What do you mean? We need to sort out dentistry. Men are invading women's spaces. Men are invading women's sport. Men are being lauded as women, right? And Keir Starmer's answer to that is teeth. Oh, God, it's absolutely insane. So they've now started this whole campaign. I don't know whether you've seen it. This has got nothing to do... Well, actually, it sort of has, because it's about medicals, right? But he's gone. Right, okay, so let's do it. Right, now, right, what are we going to do? Right, we're going to improve the health of all the children in the UK. This is absolute insanity. It's mad. Right? Before yesterday, nobody was talking about that. He thinks he's found an issue, right? That'll take people's minds off what's going on. So the way it goes is, well, we're going to help teach children to have better teeth by having teeth brush monitors wandering around the country, smacking them on the wrists with a ruler. Right? Scrub harder, smack. But mummy, scrub harder. Right? So he's doing teeth and dentistry and also the health of children and obesity. So we're going to make sure as the Labour Party that the health of children is one of our priorities, except, of course, when we want to put them on puberty blockers, cut their breasts off and make them think they're something they're not. Ladies and gentlemen, the Labour Party, right? Which brings me to, in a very bad segue indeed, trans surgery nightmares revealed. 81% endure pain in the 5 years after gender change procedures. More than half say having sex is painful and a third are left incontinent. Okay, that was a bit of a bump to earth, wasn't it? This is in the Daily Fail on the 23rd of July 2023. But again, it passed me by. I don't know why. Sometimes you catch stuff too, because sometimes you don't. One of the first studies into the side effects of transgender surgeries has revealed alarmingly high rates of post-op pain, aching during intercourse and bladder problems, raising troubling questions for this new frontier of medicine. That's a lie. This new frontier of medicine. It's not a new frontier of medicine. It's as old as the hills. The Scots used to do it. The Aztecs used to do it. It's about flesh and sacrifice. That is really weird, isn't it? The new frontiers of medicine. To call it that, the new frontiers of medicine. I mean, I'm aghast. Really, a huge majority, 81% of those who had gender-affirming surgery in the past 5 years said they endured pain simply from moving around in the weeks and months after going under the knife. I know people that are still like that for years after. But researchers from the University of Florida and Brooks Rehabilitation, a health non-profit, showed that more than half of trans surgery patients endured pain during sex, and nearly a third could not control their bladders. When are we going to stop this Frankenstein stuff? Because that's what it is. When? Dr. Meryl Alapatu, a UF physiotherapy professor, said she would publish her report later this year, but release provisional findings in a private online workshop that the Daily Mail attended. Why do we see the harm? This is why not in Osiri. First you do no harm. We see the harm, but yet we are still proceeding with this nonsense, particularly putting children on the trans train. It's absolutely outrageous. There is a high percentage of reporting, the doctor said, of musculoskeletal pain, difficulty moving and pelvic floor dysfunction, said Dr. Alapatu, adding that more research is needed in a poorly understood area. It's not poorly understood that if you hack people's bodies up, you're going to screw with them. Right? It's not like when I went in and needed an operation to save my life. That's a different ballgame altogether, smiling up at what appeared to be this godlike surgeon. He was gorgeous. Cut me. Right, so I went in, had things done. I'm still here. That'll teach you. We need to stop it all. It all needs to stop. Every single bit of it. In terms of getting information related to an efficacy of these types of treatments, we still have a lot of work to do, which means we still have to experiment on more people. It's horrendous. In terms of getting information related to the efficacy, that's what they're saying. I mean, is it efficacious? Is it a good thing? No. We don't need any more medicine, any more information. Stop it all. All of it. Surgically altering male and female genitals to match those of the opposite sex, known as vaginoplasties and phalloplasties, are widely understood to be tough and problematic procedures. They're not tough and problematic. They are impossible. They have a 100% failure rate. 100% failure rate. Women who transition to become men they don't transition to become men. Women who mutilate their bodies to look like men may opt to have a fake penis constructed from tissue extracted from their arms. Although this procedure is also complex, and the result is still markedly different it's not markedly different. It is not even vaguely close to a biological penis, a pork sausage roll made of flesh. Removing the breasts of female to male transitions is simpler. Oh, that's good. You know, it's almost like they can do it with a spoon. But could also lead to pain, infections, and such problems as stitches bursting apart, particularly on overweight patients. That's the least of it. The procedures are hot button issues in America's culture wars. Shouldn't be, should it? This is simple. Stop all of it. UF researchers studied 21 trans and non-binary people aged between 20 and 70 who had undergone trans surgeries in the past 5 years, mostly mastectomies and vaginoplasties. 81% endured pain in the lower back, groin, pelvis, chest or shoulders in the weeks, months and even years after their procedures, researchers found. I mean, what you're seeing there in this particular study, which is worth revisiting, which is what we're doing, that they've got 21 people. We find with all of the studies that we've seen that have come up in the past, or the information we've got, that it is always based on a very small number of people, because it is a very small number of people that have been through this process. It isn't going to stay that way, by the way. People will go, well, there's not enough research, right? So that's 21 there, telling you that they've got all these problems, and a physiotherapist who I presume works with some of these people to try and stop the pain, saying to you, this is prevalent in people that have had these Frankenstein operations, and there'll still be people who go, yeah, but we need more research, right? Okay, so above the 21, how many are you going to do? So when you get a 1,500, right, and 80% of the 1,500 say that they've got problems with their backs and their pains and all the stuff, and a third of that 1,800 tell you they can't control their bladder, at that point, will that be enough research for you? If you could let us know, so then we can stop bothering you, right? So we're going to, how many are we going to damage, right? So what percentage of the total people that have this Frankenstein operation with a 100% failure rate, what percentage of those is it okay to sacrifice so that the other deluded ones can get it? Is it 1%? Is it 4%, 5%, 12, 15, 20? How many? So will you sacrifice 2 in 10, 4 in 10, or 8 in 10? If you could just tell us, and then we could go away and stop bothering you. All right? In America, it would be the insurance companies to stop this. They have to stop funding it. In Britain, the NHS needs to say that if you take or have this procedure of any kind, mastectomy, elected because you think you're this thing, right? Or whatever it may be that comes with it. If you have that done, that you must take out an insurance policy that covers your medical expenses privately for the rest of your life. Because what you are doing is having a surgery that is unnecessary. It is not needed, it's cosmetic, and therefore should be paid for. It should not be paid for on the NHS and should not be supported subsequently by the NHS. You see how quickly it ends then. That's what we need to state. All right? God, I hate this stuff, don't you? Anyway, I'll see you later. Bye.